Hello, everyone. My name is Senator Omar Fateh. I'm the state senator representing South Minneapolis, District 62. So thank you all for being here. I could not be more proud of my colleagues who are joining us in forming this caucus and our outside organizational partners in the Healthcare Justice Coalition, who have been fighting this difficult fight for years. I also want to thank Senator John Marty, who has been the author of this legislation and has spent so much of his career fighting to fix our broken healthcare system. Healthcare justice is a major racial and economic justice issue for our state. We see huge racial disparities between our BIPOC Minnesotans and their white peers when it comes to healthcare outcomes. The infant mortality rate, for example, is disproportionately much higher for black babies, and that's simply immoral. Part of why we see these racial disparities is that under this employer-based get-what-you-can-afford system, BIPOC communities simply are not receiving as high quality of care as their white neighbors. And due to high out-of-pocket costs, they are likely to seek out and receive care. They are not as likely to seek out care in the early stages of illness, which saves lives and can prevent the major need for major treatments down the road. We begin to close the gaps when it comes to the health care of our people, but to do this, in order to do so, we must separate the quality of care from the ability to pay. There have been past attempts to do this without moving to a single-payer system. They have not worked. There's only one way to address our needs, and that is to guarantee health care as a human right for everybody. I want to close by addressing a topic that is on the minds of everybody here in St. Paul, and that's the issue of public safety. That for far too long, policymakers have ignored the connection between public safety and public health. We have tried to put the two in discrete boxes, and we have only attempted to improve public safety through punishment, penalization, and incarceration. And that is a failed approach. I think nearly all of my colleagues on both sides of the aisle would agree with me when I say this. Mental illness, addiction, these are major aggravating factors when it comes to the challenges in public safety. Yet, as a state, we do not guarantee high quality of care for those who are struggling the most. The Minnesota Health Plan is the solution to this problem. It is the only way to ensure that every single Minnesotan is able to receive high quality care that they deserve. And when it's finally passed and signed into law, Minnesotans can begin to see its far-reaching impacts in racial equity, economic equity, public health, and public safety. So I'm grateful to everyone who is here with us today. So let's come together and let's get this done. Thank you.